Hello, my name is Pajni,
And I'm Carmen.
and we are back with a new update on the coronavirus.
Let's start with a quick summary of what's been going on. Earlier this year, the World Health Organization declared COVID-19 to be a pandemic. Since then, we've had worldwide quarantine lockdowns, established social distancing, and have put safety measures in place.
We are currently in our second state of emergency in Alberta. In late November, new restrictions were put into place in response to the steep rise in cases. As a result, all indoor social gatherings are prohibited, a maximum number of 10 people are allowed in outdoor gatherings, indoor masks became mandatory, and schools became online again.
Now for some good news. The vaccine for COVID-19 was declared ready this December and has already been started to be distributed. There are two authorized COVID-19 vaccines, one made by the company Pfizer and the other one made by Moderna. Health Canada has approved both of the vaccines as safe. The Pfizer vaccine has been found to be 95% effective in preventing COVID-19 based on studies with 44,000 participants. The Moderna vaccine was found to be 94.1% effective based on studies with 30,000 participants. The Pfizer vaccine has been approved for all individuals 16 years or older, and the Moderna vaccine has been approved for those 18 years or older. Both vaccines are injected into the muscle of the arm. 2 doses will be given 3 to 4 weeks apart to provide the best immunity, and full immunity will be given 1 to 2 weeks after the second dose, depending on the vaccine. It is unclear how long the immunity will last, so wearing masks will still be mandatory after vaccination. Possible risks to the vaccine include pain at the injection site, tiredness, headache, chills, fever, and nausea. There is a very low chance that the vaccine can cause a severe allergic reaction.
All vaccines are given to Canadians for free. The Pfizer vaccine is made up of mRNA, fat molecules, salt, and sugar. The mRNA is part of your genetic material and is like a recipe that gives the cells instructions on how to make spike proteins. The spike proteins are what you see protrude out from the coronavirus and are helpful in attachment, fusion, and entry into your cells. The fat molecules in the vaccine are used to cover the RNA so that it can enter your cells. The salts are used to make sure that the conditions of the vaccine match that of the human body, and the sugar is to make sure that the ingredients of the vaccine don't clump together. The Moderna vaccine is made similarly. When the vaccine is injected, your cells will read the mRNA, produce a spike protein, and destroy the mRNA. The body's immune system will see the spike proteins, realize that it is foreign material, and destroy it. The immune system will then develop memory cells to detect the same protein. If you were to be infected in the future, you would gain protection as your immune cells will be ready to fight the virus before any damage is done.
The vaccine will first be given to healthcare workers, senior caretakers, adults 70 years of age and older, and adults in Indigenous communities. Next, priority will be given to essential workers like the mailman, as well as individuals living in shared housing, including homeless shelters and prison. It's predicted that the general population will receive the vaccine in fall of 2021, but this timeline can change.
According to Prime Minister Trudeau, we're on track to have at least 1.2 million doses of vaccines from both Pfizer and Moderna delivered by January 31st. In order to reach herd immunity, about 80 to 90% of the population must be immunized, which is expected to happen around July to December of 2021. Thanks to the vaccine, we are one big step closer to eliminating the virus. This is a graph of the number of new cases every day in Alberta, and Calgary follows a similar trend. As you can see, the second wave is significantly higher than the first. We want to lower this curve. Even though vaccine rollout has started, it will still take a couple of months before everyone is immunized. Therefore, it is very important to follow the safety protocols and be vaccinated.
As the pandemic continues, corona fatigue is becoming a prominent issue. It is taking a toll on mental health as people are getting burnt out and are exhausted. It is not easy, but we need to continue taking safety precautions. Here are some different ways to cope if you're struggling with corona fatigue. Exercise. Even taking a brisk walk can make the difference in relieving stress and feeling good. Talking to others. In this age of technology, there are numerous ways to stay in touch with family and friends. Try video calling or sending a text if you're finding it hard to be alone. Hobbies. Try pursuing a hobby or activity that you've been meaning to try. Puzzles and games are good ways to stimulate your mind when you're sitting at home. And for those who need support, help is available.
We have gotten through almost 10 months of this pandemic, and I have faith that as a global community, we can defeat this virus together.